Carolina's healthcare system is one of the nation's largest and most innovative healthcare systems in the country.
We have the comprehensive liver program, which includes hepatology, we have HPV surgery, therapeutic endoscopy, and of course the liver transplant team.
We pride ourselves at Carolina's healthcare system on delivering a patient-centered, personalized approach to healthcare with a multidisciplinary team.
Mr. Cathcart had a primary liver cancer, and it was actually very extensive.
It was pretty much a death sentence at the time. You can't have an organ much more vital than the liver, and to have a softball-sized tumor that was cancerous was devastating. Matter of fact, I cried like a baby in my wife's arms.
What we did was a multidisciplinary approach through GI, through interventional radiology, and with HPV surgery. We're able to put together a comprehensive treatment plan for him.
David Iannetti and his team have led the way in the development of microwave ablation technology.
We were able to put chemotherapy and other treatments directly into the tumor through the arteries, and also by blocking off some of the blood supply of the diseased part of his liver, we allowed the normal part of his liver to grow larger, and we were able to get above the threshold where we felt that we had enough liver so that we could remove his tumor.
Dr. Iannetti is world-class, as is the facility. It was a dream come true because instead of having to travel thousands of miles to get the care I needed, I could get it right here in my own backyard.
We're also one of the national leaders in laparoscopic robotic-assisted surgery for the pancreas, liver, and bile ducts. And we're hoping that through these innovative technologies, we're going to be able to make a difference in some of these cancers and diseases.
When I first came here to see the doctors, I was in pretty bad shape. Found out I had Hep C and liver cirrhosis. There was a time when I prayed every night to not wake up the next day, because that is an illness that you just wouldn't wish on your worst enemy. And then November came along and a donor came available, and it has really changed my life.
The most important aspect of a comprehensive liver program is the multidisciplinary approach to disease.
A perfect example of that is a young woman that we saw who during her 10th week of gestation developed acute liver failure. At her 11th week of pregnancy, she underwent liver transplantation. During this process, the hepatologists, liver transplant surgeons, anesthesiologists, and high-risk OB/GYN were involved with her care. She underwent successful liver transplantation. 6 months later, she delivered a healthy baby girl. To our knowledge, this was the earliest case described in the literature for a patient to undergo successful liver transplantation for acute liver failure during her pregnancy, followed by the successful delivery of a healthy child.
The research in liver, biliary, pancreatic disease at Carolina's healthcare system is quite varied, it's quite extensive. We have developed new nanoparticles and nanomaterial treatments for hepatocellular carcinoma. We have made fundamental new discoveries about what regulates the production of hepatitis C viral particles. The overarching goal is to provide clinically important, patient-oriented research and innovation with always the goal to diminish suffering, to cure more patients, and to add to fundamental knowledge, not only for our patients, but for the wider community of patients.
These patients deserve the best that science and medicine has to offer, and I truly believe that through collaborative efforts with medicine, surgery, and research, that we have our best chance to impact these patients and their diseases.
If it hadn't have been for these people here, I would not be here today.
I'm alive and cancer-free. It doesn't get much better than that.